Welcome to Book Talks, the show that speaks to education, health, entrepreneurship, and so much more.
Ndi masheroni ndine mukororo wa hamakhuba munjezi makhuba. So namusi ndina Dr. Stanley Moloabi. So I'll be interviewing him today. He's from James. Good morning, Dr. Stan. How are you?
Rumachironi and Castanara Dumela.
Hey.
I'm good. I'm happy to be here.
I'm also very happy and honored for you to be here. So can you start by telling us a little bit about your role at James and your background in the healthcare industry?
Well, my role at James is that of a principal officer. We always make it easy for people to understand. Principal officer is like being a CEO of a company. And the role is basically to firstly implement the decisions of the Board of Trustees, who are the oversight forum that oversees that the scheme is run properly. Apart from that, I am the accounting officer of the scheme, but at the end of the day, I am responsible for the day-to-day operations of the scheme in total.
Wow, it's very interesting. And I'm so glad that we have you today because James, a lot of people who are in government, they are using James Medical Aid, including myself.
Oh, that's wonderful to hear.
Yes, and I also do have a background when it comes to James because I'm also working at HR administration. So the James thing, when it comes to people inquiring about the medical aid, they come to us.
Oh, that's wonderful.
Yes.
So, and I know that you always give them the wonderful things that we do. Especially what is very important is the benefit coverage. So we need to cover most, if not all, of the ailments that anybody can suffer from overall.
Okay, thank you so much. So how has James evolved over the years and what are some of the most significant changes you've witnessed ever since you've been at James?
Well, over the years, actually, just to state that James was actually registered as a medical scheme in 2005 and started operating in 2006. But basically, if we take 2005 as its birth date, then what it means is that we are actually 20 years old this year. We are getting out of teenage years.
Wow.
Over the years, we have grown very significantly. As you mentioned, we cover employees of government, so-called public service employees. And we have grown from that one member who registered in December 2005 to now where we are in excess of 890,000 members.
Wow.
And these are the principal members, the ones who pay, or the ones, the workers and pensioners of government. They also, remember, take care of beneficiaries of dependents. So we have over 2.3 million beneficiaries. So those are the total lives covered, both the principal member and their dependents.
Wow, very interesting.
Yes. No, absolutely. It's been phenomenal.
Yes.
Yes.
And how has James impacted the lives of its members and what stories can you share?
Wonderful stories we do have. And, it's always wonderful if these stories were to be told by our members or our beneficiaries who have experienced them. But over the years, we have grown to become the second biggest scheme in the country, the largest closed medical scheme, closed because it covers government employees. And the type of stories that we have, it's things like, our members being on the brink of probably death. Yeah, because they've been involved in severe motor vehicle accidents. Staying in ICU for recovering for a very long period, and ultimately us covering those costs, because the importance of a medical aid is that we pool the funds. So I always make the example that a medical scheme, it's like it's like a stock fair.
Yeah.
We all put money in the big pot, and at any point in time that any one of us needs to access these funds, we do that within the scheme rules. So one of the stories would be a person who ended up with bills of up to 2 million rand and sometimes even more. Last year in 2024, the highest account that we paid for a child who had hemophilia. Hemophilia is the bleeding disorder. And he had a red one where they use a very rare medication. The cost per annum for such a medication, it's 7 million rands.
Wow.
And because of our size, because of the fact that the cross-subsidization is the way to go, we are able to cover that. Can you imagine if you don't have a medical scheme like GEMS?
Yeah, that would
And
be
then
true.
where do you get 7 million from?
That's another thing. It means
Exactly.
now you'll be indebted.
Well, actually, bankrupt, 7
Yeah.
million is a lot of money. I don't think a lot of us would stay that would even have property that's worth 7 million.
Yeah.
Exactly. So that just tells you how impossible it can be. So that is the type of role that GEMS plays on behalf of our members. So, in essence, we have to be there for our members when they need us most, and that's when they are most vulnerable.
Yes.
That's basically, and that's what we do.
Wow. Very interesting, Dr. Stan. Very interesting. So, in managing the healthcare needs of public service employees requires financial planning. What
Yes.
strategies does GEMS employ to ensure financial sustainability?
That's a very important question. Absolutely in question. Absolutely important, rather. So, firstly, if you don't plan, then you will not reach your destination. And our destination is our vision, which is to be an excellent, sustainable, effective medical scheme that drives transformation in the healthcare sector and also strives towards realizing universal healthcare coverage. So basically, at the end of all of this, financial sustainability is very important. Because if we are not financially sustainable, we will not be able to meet the needs of our members by paying for their claims. So how do we, your question is basically then, it really centers around financial planning. It's a very complex issue. So if you take a group of people, 100 as an example, let's say that's our membership, and they contribute 8,000 rands towards the scheme, so per month. So we would collect 100,000, and then what is it, about 1.2 million by the end of the year. So if we had that patient that we needed to pay 7 million for, we wouldn't get it.
Yeah.
So firstly, you have to determine the right level of contribution. Clearly, 1,000 rands would not be adequate. But also it's important that you attract members for growth, and then you also ensure that you set that contribution at the right level, and then you have to now have rules of what benefits are you entitled to, right? And you have to, everybody has to play by the rules. So if I need spectacles, and then I go there, then they start telling me, well, the spectacles is 3,000 rands, but you can also have sunglasses for 2,000 rands. The 2,000 rands is not allowed. So we don't allow things like that, which then makes us sustainable based on what we are expecting to receive. The other thing is, when you have these 100 people, you should have actuaries who are the experts in determining how things can pan out in the future. So the actuaries would then use actuarial model to say, well, based on your risk profile, your demographic risk profile, which is your age, also the gender would also influence the risk profile, the lifestyle of those people that you cover. You will you must expect that 30 of those 100 will claim.
Wow.
And out of the 33 will end up in hospital. So when you model finance, you model according to those predictions. And then if you model accurately, and the factors that we have looked into, the age, the possible admissions, who is likely to fall sick, and even more importantly, we should also provide for prevention and screening, which is preempting so that we don't catch these illnesses when they are advanced. With all of that, then you attain financial sustainability.
Wow, quite interesting, hey? Because Dr. Stan, I've heard stories of people saying that they exhaust their medical aid even before the year ends.
Yes.
I've also suffered from such as well.
Yes.
Is there anything you can say about it? What may be the cause of that?
If you start sneezing now, and then you start having a bit of a headache, and then you say, I think I've got a flu, don't go to your specialist.
Oh, okay.
You don't even go to your GP first. You usually go to the pharmacy and say, can you give me something for my flu? And then they'll give you something for your congestion. They'll give you something for your headache. And then responsibly they will say to you, look, if this thing doesn't get better within 2 to 3 days, that normally happens with a flu, then we advise that you go and see your GP. So what then happens is people don't do that.
Yeah.
You have the sneeze and the headache, you go and see your GP. Let's leave the one who goes to the specialist. That's even worse. You go and see your GP. The GP prescribes, Panado, paracetamol. It's white in color. And then he gives you some medicine, says it's for congestion. It's green in color. You take it for 2 days. You feel you're not getting better. You say to your neighbor, I've been to the doctor and I'm not feeling better. And he says, which doctor do you go to? And then you basically say, no, I went to Dr. Stan. He says, no, you shouldn't have gone there. You shouldn't have gone to Dr. So-and-so, who is very good with flu. You don't take your Panado and your green medicine to the doctor to say, well, by the way, I went to the doctor 2 days ago and I'm not feeling better. Maybe you can add to this man. No, you don't reveal. You go there as if it's the first time you go. So what happens, you get 2 sets of, now he gives you a green Panado and a pink medicine. Medicine was different color. You think you stop drinking that other medicine, you drink the new medicine. That's wastage. You have done 2 consultations, probably which you didn't need both of them, because you should have started maybe at the pharmacy to try something, and then only when you don't get better, you should go and see your primary health care doctor. If you're not feeling good, you go back and say, I'm still not better. They will then charge you not a full consultation. They'll charge you and they won't repeat the medicines that you're going to pay for anyway. If we did that as one of the things, there's so much saving. So there's a lot of wastage as a result of our behavior to our health-seeking behavior.
Okay. Well, thank you so much for the information. I hope you all have heard that, especially the ones who are using GEMS medical aid.
Yes.
The reason why you're always exhausting your medical aid is because of not being more informed. So if you listened to what Dr. Stan was saying, you could really save a lot of your funds. So with adjustments to healthcare contribution in 2025, what factors does GEMS consider when making annual medical scheme contribution adjustments?
Yeah. So for 2025, as you may be aware, we really had a difficult time in terms of the contribution increase that we basically came up with. And to your question, the things that come into consideration, which end up determining that annual contribution increase, would be things like the claims experience in the prior year. So I spoke about actuaries. So if the claiming behavior is a certain pattern, they will use that to predict what the healthcare needs are going to be. And then based on that expectation, we would then say we will need an extra so much, which also includes the inflation. And inflation in health tends to be higher than the normal basket inflation, which we normally refer to as CPI, the Consumer Price Index. There is other elements within health that make health products that we use more expensive. And as a result, the medical price index is higher than the CPI. So it influences what the increase are going to be. There's also the issue of members. So let's say we are a population of GEMS members, and nobody joins the scheme at the end of 2024 for 2025. Nobody new joined the scheme. The effect will be that this group of people will be a year older next year. And in health funding, being a year older can translate to more costs. Because the older you are, just think about it. When you were young, it would be very rare that you go to the doctor.
Yes.
But the older you become, they start saying, you must go and check your doctor at least once every year, so that you can go and do check for high blood. They check, they do the pap smears, they check for males the prostate, all of these things that need to be checked. It starts middle age, 40s usually, but things like cervical cancer, we now know that we have to even start checking for it much earlier. You do have to go there, the doctor examines you for the breast, if there are any signs. So all of these things, as you become older, you have to be more frequent. So aging, that's the second thing that I was explaining in terms of what contributes to contribution increase. And then the other thing that's also very important is new technology. So let's say, I'm going to use names that I think are generally used. So say for cough, generally you use Borstal. And you've been buying Borstal at 5 rands. And then suddenly stands pine tar and honey. They introduce it into, and it comes at a higher price. So that, and these are over-counter medicines, as you know. They are lucky that I gave them a pound. So then this new one comes at a higher cost. So because people will want to use the newer one, it probably tastes better, whatever the reason why it's new. It costs more than what we had budgeted for, and that also influences our increases.
Oh, all right.
Yes.
Okay, thank you, Dr. Stan. So as the NHI becomes a reality in South Africa, how does GEMS envision its role within the broader context of the NHI?
Yeah, so we've always at GEMS said, and that's the position of GEMS, that GEMS supports the government in the implementation of NHI towards realizing universal health coverage. So so GEMS earlier on, I basically indicated that our vision was to be an efficient medical scheme that's sustainable. So the business of a medical scheme is to collect funds, to finance funds, and defray healthcare costs. So we're involved in health. And with that, we gained enormous experience in how you fund a population like 2.3 million, which is just over 20% of actually the medical aid population in South Africa. So GEMS is quite big. So what we did over the past few years is that as the legislative process for NHI was underway, we started saying, what role would you want to play when NHI is implemented? And there's a lot of work that we have done, whether it's benefit design, whether it's costing, the costing that we spoke about earlier on, whether it's payment of healthcare providers. Because one of the biggest problems that we are having in South Africa, our model is based on the so-called fee for service. So fee for service is, you come through my door, I'm going to charge you as a healthcare provider. The more tests I do, the more examination procedures, surgical procedures, whatever interventions I do, you charge per item. And that incentivizes what we call over-servicing. So I'll do things that you may not even need because when I'm not using. So what we are doing, so that's the funding models. What we are saying is that GEMS has been doing things, readying itself for an environment where NHI is implemented, and we are ready to be part of the journey. Remember, it has been said, the act has been ascended to by the president, so it is an act of the country, right? But the implementation, it's going to be a phased-in implementation, and this has been said when there's a commentary by the Department of Health on NHI. So the envisaged role of GEMS is to become part of that phased-in journey to ensure the success of the implementation of NHI towards realizing universal health care.
Okay, thank you. Because I've heard a lot of controversies when it comes to NHI. There are some people who are opposing it, feeling that it's not going to benefit people who already have medical aids. What's your take on that?
It's a very complex, very topical. It's in the public discourse. There are court cases at the moment. There are people who believe that they want to contribute certain ideas. In fact, they are contribute certain ideas to what they perceive to be a very inadequate NHI Act as it's written. We now just have some, and it's not all. Some publications, we have got some regulations published by the minister calling for comments on mainly governance. So if you look at the fact that it's only on governance, those resolutions only, there's still a lot of work to do. So there are definitely people within the space of healthcare funding that there are court cases. There are those who have commented publicly, published that in its current form, they don't believe that NHI will be successfully implemented, right? So I don't know whether to say controversy, but we also know that there was somewhere along the last year where the president said, I'm prepared to listen to everybody. And so all of these things are unfolding in a very complex and challenging environment. South Africans, we are always known to overcome challenges.
Yes, definitely.
And I'm hoping that I'm positive that we'll overcome these challenges.
Yes, most definitely. So what are some of the key initiatives and projects that GEMS has planned for the year from this point forward?
Well, the biggest initiative for GEMS is that GEMS must pay all the claims that are valid on behalf of me. That's really the business, but we do have opportunities to do other things. And I think one of the biggest things that we're looking at is ensuring that we now fully develop our ESG, right? Yes, so it's environment, social governance, ESG. That's topical. So there are activities. A week ago, I was in the Free State where we were basically going to make a donation towards the livelihood of primary school children. You know, when they talk about the social determinants of healthcare, children going to school not properly dressed even in the winter, sometimes without shoes. How do you expect these kids not to fall sick? So to the extent that we are able to, within our means, we then contribute towards helping such. We can't do it to the entire country, but we will have identified various areas in the country when there is such a need. So that is one of the things. Some of the things that we have done, last year we did a renovation of one of the academic hospital in Pretoria, that's Steve Biko. And then we also were in Cape Town, where we also donated some neonatal unit equipment, and also there were some renovations. So these are the activities. And then we also have certain clinics, and our hope is that we do this more in the underserviced areas. It should be a rural type of, sometimes peri-urban. So we've got a big project in Soweto that we're still on the pre-administrative work. But this is a clinic in Orlando East, where Mrs. One of our stalwarts, Mrs. Sisulu, Albertina Sisulu, she actually worked there as a nurse some years back.
Wow.
So these are some of the projects that we undertake as part of our social responsibility.
Okay, thank you, Dr. Stan. So how does GEMS plan to continue innovating and improving its services to meet its evolving needs of its members?
Very, very important answer, a question about innovation. So, anywhere where you operate, doesn't matter whether it's in communications, whether it's in health, if you don't keep up with the trends, then you are going to become what we normally refer to as a dinosaur. You become a dinosaur. So what is in the public space now, when people talk about innovation, it's digitization. And everybody, then when we started talking about this predictive modeling, that's what it was generally called, but now it's called AI. Also, you put information in machines, they learn, and then they start assisting you, machine learning. So all of this under the banner of digitization. Digitization is so important that it can even make it unnecessary for you to be in hospital, where you are exposed to, we call them nosocomial infections, which is basically hospital borne infections. So let's say we can keep you out of hospital simply because you have a wearable. You know the smartwatches?
Yes.
So
I'm also wearing one.
of course. If you can check, you can tell us what your BP is or what your pulse is at the moment. Do you know when you are sometimes kept in hospital just to check those? The way it used to be done. Every 4 hours, BP, temperature, all of these things. You can get it from your wearables. So what then happens is you have instructions to be at home. Take your medicine every time. They will actually phone you and check, have you taken your medicine? Then they will be monitored. These, you don't even have to tell them. They will be uploading to the people who are monitoring your health. And if they see, this BP is going down, then they will come. It is much, much cheaper than being in hospital. So when you talk about innovation, these are the things where we are going. Now, when you think about GEMS being the largest closed medical scheme in the country, the amount of data that we have, that we own as GEMS, it's massive. So it's these data, these data sets we use to determine certain trends, and then we take business decisions on. And that's where innovation comes in handy. So these are the type of areas where we are looking at data, AI, digitization. These are things that you have to look into.
Wow, thank you so much, Dr. Stan. Very interesting. Who would have thought that AI would contribute to a medical field? Imagine being at home or being wherever you are and not actually being admitted to a hospital. That is something that a lot of us want, especially people who have a fear of being in hospital environments like myself. When I go to the hospital, even if I'm going to visit someone, I have that panic. I don't know if there's a medical term to it, but I don't like hospitals. I don't like them at all.
Yeah. Well, you shouldn't panic, not mainly because you are a GEMS member.
Okay.
Yes.
Noted. So, how can our viewers or followers get in touch with GEMS or learn more about its work?
Yeah. So obviously we are on several social media platforms. The easiest one is www.gems.gov.za, and then we would be on Facebook, Twitter, LinkedIn, and the handle generally is GEMS Medical Aid.
All right. You can see it on our screen. Okay, thank you so much, Doctor. It was such an honor and a pleasure to have you here with us.
It is an absolute pleasure, and thank you very much for having me.
Okay,
Right.
thank you.